discussion.
No, I
Yeah,
think
perfect. Yeah.
what you were discussing, it is related to what I am going to talk. And basically, as you rightly said, no, now it's not that there is no awareness. No, the awareness is there. Like the national health policy, as Grover Ashok was, presenting, national health policy, ocular trauma has been included. Similarly, like in Delhi, firecrackers, in Diwali and all that, there is a kind of a cap that after 10 o'clock you can't this thing, and also the amount of decibel, how much sound you can make during these festivals and all that. That portion is on decrease, but the other things are on increase. Like ocular trauma is on increase because of we have so many industries are there. If you go in some remote areas, you come from Gwalior, and also places like Gorakhpur, or places like some other places in Bihar, where the workers are there, like welding, somebody is doing welding, is not wearing any kind of protective equipment. So many other similar kind of profession is there where people are not aware, and the people who are employing them, they are not interested in that. So all these things are making a very complex situation. Now we have this this terrorism is there. Now I think Natarajan, he'll say that, he went to Kashmir and he did a lot of surgeries on ocular, this thing, retina and ocular trauma. So these things are, keeping this ocular trauma at a very, critical stage. Like road rage, there's a lot of the young people, they are coming and, with hot brain, and they start fighting, So all these things creating problem. And then regional issues, what we were talking now about the cultural issues like festivals, bow and arrow injuries there. Of course, now all these things have come down because of the, I was associated with National Society of Prevention of Blindness for a very long time. And we had those posters, I think Purnendra must be knowing about that because he was also associated with that. So those things are there. But on the other side, we still need to do very much. Now, as I told you that it is now getting recognition. Now, I think you must have all seen that in all the states now, they have focus on trauma, not ocular trauma. Trauma is a general. You will see the trauma centers like we have in AIMS. So something like this, it is being duplicated in the entire country. Trauma centers are there. But specifically ocular trauma, I think we need to emphasize with the government that even where you are having an ocular, this a trauma center, there should be a separate wing for ocular trauma also. Because ocular trauma is a specific and a very, exclusive kind of specialty where you need to have kind of training facilities, you need to have the management facilities in terms of equipments and other things. And then, still we need to have a very concerted effort, as everybody said, that we need to have a kind of a very strong advocacy. We all speak here, but then when we go back, we all get into our patients and our job. But then if we consider that this is also our job and a part of the job, say if 25% of our energy, if we have to put towards this, then definitely it will be very successful, which is very difficult. But then, for a cause, you can definitely work. I think what we need to, why ocular trauma is important? The trauma is important because it is if you don't take care of this, there'll be a compromised workforce. People who are young, people who are exposed to this, trauma, they are the ones, who are suffering and who are a loss to the workforce of the country. And that, causes decrease in the GDP, the national growth rate and the national workforce. And this, causes workforce pressure on the other people whose number is limited because of the problems associated with their colleagues. So we all know that we need to aware, people who are making the policy and the peers. Like we discussed that we can, I'll just tell you, we can make a universal advocacy document. A document or a charter which says that for these reasons, the ocular trauma is more important than any other trauma. I will not say head trauma, because head trauma, of course, if somebody has got a head trauma, he's gone. But then ocular trauma also holds a very important position in the entire gamuts of ophthalmology. And then, we need to have industrial law for safety of workers. I was talking about the welding and similar kind of jobs. There are a lot of jobs, even wo jo, kya naam hai, what you call as a chiseling. So those kind of small, work is there where people are totally exposed. And there it is there, and there is no kind of, no regulation or nothing of that kind, or protective devices are there, but they are not distributed, or people are not aware about it. So those things are there. And the most important, what we were talking about, that we need to have a collect data. If we collect the data and we put it in the right perspective and put it in the universal advocacy document and say, look, sir, as I think who presented, Raji presented, that 0.3% was when the firecracker ban was there in those countries. And countries where no firecracker ban is there, this 2.7%, it makes a huge difference. You extrapolate this on the total population of India. How much is 0.35% and how much is 2.7%? So it's a huge difference if we can make, if you can just simply write this thing, and then we can simply write that so much of blindness is there and so much pressure is on the workforce of the country, and so much is dip in the GDP is there, then people will understand. Now everybody is talking about growth rate. The country, the different parties, they are saying them, our government, this is the growth rate. But this is our party. So we should talk about our party, what our party needs. So we need to, work together and do it. And then on the operational side, Ocular Trauma Society should connect with the people through posters, hoardings, and banners. The banners should be there, just like polio, 3 bund polio ke. So usi tarah se, if we can put it up, on the back of the bus or the bus stand. So we need to talk to the people who are doing CSR, corporate houses. If we talk to the corporate houses and tell them, look, you take care of the posters on the bus. Or we can talk to some other people, like lots of other agencies are there, government agencies are there. So they will help, even the railways. So I think it's a huge job, We can't just sit in this room and we talk and then we go, that's what we do. I mean, frankly, we should admit, because of our, engagement in, our own profession. So that is very important. And then, of course, you can give an interview, or some news should be there in the electronic media or the print media, or something, some kind of do's and don'ts. So if we put it in the newspaper, so I think that will be very helpful. And then observe Ocular Trauma Week. So during that week, everybody works on ocular trauma, focuses on prevention of ocular trauma, focuses on awareness, focuses on the training to young ophthalmologists on the management of ocular trauma. I see, the people who come with perforating injury, the thread sutures are there, 40 sutures on the cornea. So people need to be trained, So those things are very important. So I will, request all the people who are here, although it's a small group of people, but I don't think for this we need a very large group of people. So we need to emphasize the need to declare ocular trauma as a priority area by government and also by non-governmental agencies. We can draft a universal advocacy document. And thank you very much.